Welcome to Healing Minds, Stories of Resiliency and Recovery, a conversation held at the intersection of substance abuse, mental health, and everyday living. Your hosts, Marc Regala and Justin Wolf, bring both professional expertise and personal understanding to the table. So welcome to the conversation. Let's dive in.
Hi, everybody, and welcome back to another episode of Healing Minds, Stories of Resiliency and Recovery. My name is Justin Wolf. I'm joined by my co-host, as always, Marc Regala. Marc, how you doing today, big guy?
Trick or treat.
Oh, you warm my heart every day.
Trick or treat. Are you in costume?
Yeah, I already told you that. This is what I went as, and I got shunned at every door. So, no more Skittles for me, man.
Not a bad thing. Bad thing for you, but it's not a bad thing in the totality of things.
I don't know what you're trying to do. Trying to fat shame me here on camera. This is awesome. So, the weather update. Yeah, trick or treat. Fantastic. I know it's a dramatic build up to. I got it.
No, I mean, it's hard to believe, man. Clocks are going back here pretty soon. It's November 1st, right around the corner. Thanksgiving is, 4 weeks away? Christmas is, 8 weeks away? Again, I don't know where the year has gone.
We might not know where the year's gone, but we know where the math skills lie in this duo here. Look at that. Just full display. Man, fast counting. When you got it, Marc. That's all there is.
Simple math, Justin. Simple.
Thank you, educational system.
Yeah.
Awesome, man. Well, today we're going to talk about the age-old topic and kind of dive into it and have a discussion. I know you and I kind of talked about this before we kind of jumped on here and really looking at the good old discussion of, is addiction or substance use disorder, however we want to kind of frame it, right? Is this a disease or is this a choice? And this question, when we kind of dive into it and look at, this isn't just like an academic question. This isn't something that we're kind of like, let's check the research. What does the research say? Because it isn't just about finding the answer there. What ends up happening is that this is that ongoing frame of mind that people carry with them that impacts the way that they respond, they treat, and they address individuals who are impacted by substances. This affects our healthcare system. This affects our programs that people participate in. And it also affects our own attitudes that we carry towards those who are in pain, caught up in the thralls of their mental illness and their addiction. And so that's where today I think we're going to kind of do our best to kind of dive into this and look at, hey, what does science actually say about this? Like, what does that research say? What are those who are like the critics that kind of say, hey, no, this is a choice. This is a moral failing. It's almost like the age-old adage of like, hey, some people like, I guess everybody was born with like a full deck of cards and I just got dealt a couple that were short. Like, that's not cool. Why is this not fair? And then we'll kind of look at, both ends of this. But before we kind of do that, let's kind of dive in and kind of define what addiction is, because it's one of those terms that gets thrown around there pretty loosely, right? And the one thing that we do know is that not everybody who uses substances develops a substance use disorder or struggles with addiction. So let's kind of define what this is. According to ASAM, or the Addiction Society of Addiction Medicine, they define addiction as a chronic relapsing disease of the brain that is characterized by compulsive behaviors and continued use despite harmful consequences. So this means that people are continuing to use substances, and they recognize this despite the impact it has on their health, their jobs, their relationships, their sense of self, every aspect of their lives. But why? Why would people continue to go down and engage in a behavior that has such profound impact on every facet of their life? And so this is where the disease idea and concept comes into play here. And so what we know is that when you put a substance into your body repeatedly, it is going to change the way your brain works. And what we know is that there's been a lot of brain imaging studies and research done showing the brains of those impacted by substance use disorder of a variety of different substances, showing the changes in the brain, primarily in the reward system. So this is when we're talking about dopamine circuitry up there. The dopamine, we're really trying to get that. Like it hijacks that system. And it makes people say, I need this substance, drink, pill, powder, whatever, to feel normal. And what ends up happening is that over time, this structure and the way it functions changes. Those changes impact self-control, decision-making, and the ability to regulate one's own emotions. This is why for a lot of people on the outside, looking at the individual who's impacted by this, they might look at him and say, hey, that behavior is out of control. They're unpredictable. And to the individual caught up in it, the behavior makes perfect sense. Especially when it's like, I need this substance, I need this pill, I need this drink in order to survive, because it goes to the top of that food chain. And so Nora Volkow came out and said, the director of NIDA, addiction is not a moral failing. It's a brain disorder. It changes the way the brain processes rewards, stress, and self-control. So from a neurological standpoint, addiction fits the criteria for a disease. It's got observable symptoms. It's got a biological dysfunction. And for recovery, it requires treatment. So Marc, I'd love to kind of get you to jump in here and kind of share your thoughts and kind of what you're thinking now.
Well, go back to that first definition, the first 4 words.
Which part?
Oh, Sam?
Addiction is not a moral failing? That part?
No, the first one.
Oh, man, you got to make me go. So, addiction is a chronic, relapsing disease of the brain.
Yeah, just stop right there. There you go. Disease of the brain.
Yeah. Like, that's where it all stops.
Podcast over. No, but but in all seriousness, I mean, from what I understand, and this is one of the things that I learned when I was in treatment, is when you start talking about alcoholism, the American Medical Association classified it as a disease back in 1956. If you start talking about addiction, which they renamed substance use disorder, they classified it as a disease in 1987. I understand where people are going with this. You know, it's placed in a disease similar to cancer, diabetes, MS, and other diseases, okay? I understand where people are going with this, that it's your choice to drink, it's your choice to use, and I respect that, okay? But when you start talking about, when we use diabetes as an example, isn't it somebody's choice to eat a package of cookies at nighttime on a regular basis, or a half gallon of ice cream, or have high sugar? I mean, it's dietary. I mean, they're putting it in their body, and they're having consequences as a result of the toll that it's taking. But at the end of the day, it was their choice. Okay, now is there hereditary components? Yes. Is there hereditary components with heart disease? Yes. Is there hereditary components with mental health and addiction? Yes. You know, I mean, those are other factors as well. But you know, what I don't like is when people say, "Well, you chose this life, or you chose to be an addict, or you chose to be an alcoholic." Yes, we chose to take a substance. Yes, we chose to take the first drink. But the way I look at it is no different than somebody who chooses to eat a bunch of sugar, or a bunch of cookies, or a bunch of candy that eventually becomes a diabetes. We don't shame them. We don't guilt them. We might give them a little bit of a hard time, but the shame and the guilt that's given to them is nowhere near what you're going to give somebody that's battling with alcohol or substances or what have you. And I think that's where, as a society, we have to get a lot better, and we have to get better from an educational perspective.
Absolutely. No, and I think it's spot on, man. Because I think a lot of times where the counter argument comes in, where you're kind of bringing that and talking about that, it's always hey, what about the personal responsibility in that decision, right? Like there wasn't a gun held to your head, and I think that's the part where it's like, hey, nobody forces anybody to take that first pill, drink, powder, whatever it is. Generally, peer pressure happens, right? But what initially starts as a choice, right? Like the first use, usually voluntary. And you look at the reasons why use is happening then. The reasons why people begin using is very different than the reasons people continue to use.
100%.
And so that's the part where you start looking at that component of like, hey, when does that voluntary decision no longer become voluntary? When does that biology hijack the system because it's being altered and changed by the repetitive use of the substance and all those associated behaviors? When does that kind of take the controls here and start driving the actions, the choices, and the decisions that the individual is making? And so that's a hard thing, especially for people who are going through it. And I've run into, and I know we're talking about a lot of times other people kind of looking at individuals impacted. And for people who are themselves living this, there can be so much guilt, shame, and remorse over the way that they're showing up, the way that they're continuing to engage in these behaviors, that, obviously depression kind of starts feeding into this as well, where it's like, I feel bad, so therefore I'm bad, and I'm making this choice. Like, this is my decision. I caused all this pain and suffering. Like, I made the choice to consume that drink or to do that line. Like, that was on me, right? And I'm sure you've heard similar things from people.
Well, I felt the same way.
Yeah.
I mean, we talked about this. I mean, I had a lot of shame. I had a lot of guilt. I thought I was defective.
Yeah.
And then I did hear those stats in treatment, and that it is a disease and it's in the same category as those other major diseases. And it got me to rethink things over. And from my perspective, I was able to process things differently because then I viewed it as a disease and I'm just sick. And that helped me get into sobriety, and that helped me get into recovery, and that helped me process some of that shame and guilt. And I know what you're saying about repetitive usage and where does it draw the point, where does it draw the line, or when does it cross over where it's rewired your brain and now your brain needs it. I mean, again, I thank God I don't have diabetes, so I'm not sure exactly how that disease works, but I mean, the same thing can be said about that, with the pancreas and insulin.
Mm-hmm.
By what you're putting into your body, where is that line crossed?
Right.
I mean, it's decisions that we make. A lot of diseases, yes, again, you get the hereditary component, but a lot of diseases usually is triggered by lifestyle.
Right.
So why would we view addiction or why would we view alcoholism no different and shame those individuals or guilt those individuals? Especially when the American Medical Association and other organizations view it differently.
Right. Because I think that's where, and I think that's a great question, Mark, because it's spot on. Like, why withhold help, support, and care and concern from people and respond with like the stick, right? I'm going to punish you. I'm going to beat you into like making this change. And I think that's the part where sometimes people view it as a very selfish disease, right? And people are like, they're hurting us. They're causing all this pain. When it's like, they're in so much pain. I'm in so much pain. I'm just trying to get rid of this and put out this fire.
Yeah.
And now I have intent. I have this additional guilt, remorse, and shame because I can also be hyper aware at the same time, just how I'm impacting those that I actually care about and I love too.
Yeah.
And so that's the part where, where you're looking at this moral failing, the selfishness, if you kind of throw in the religious aspect, like it's sinning, right? The danger of keeping this frame and the danger of kind of viewing this as a choice and taking the disease concept out of this really impacts the way we respond and the way we treat those who have acquired this illness and disease. And obviously, you and I both have a slant on which angle we think it is. But if we think it's a choice and we think it's a moral failing and that it's just bad decisions being made time and time again, people are much more likely to respond with punishment versus treatment. And so that's when you kind of look at how does the healthcare system respond versus like the justice system respond.
Sure.
Two very different. And so if we see this as a disease, what are we going to do? We're more likely to then turn around and offer treatment and support and resources that are going to provide hopefully some healing and some growth. But if we see this as a choice, we're going to respond with shame, stigma, and punishment.
Yeah.
That's where the old adage just reminds me of like this old saying, hey, if I can make you feel bad enough about it, then you'll do something different. Or I'm gonna break you down to kind of build you back up.
Yeah. I mean, it's like way back when somebody was battling alcoholism, where did they put them in?
You mean
I
the
mean,
drunk tank?
they just institutionalized them.
Yeah.
You know, and now where there's, full treatment facilities and people can heal and people can get better.
Right. And that's the thing where it's like many people recover from this.
100%. And then, the other thing too, as you're talking, I'm thinking about this, and actually, I just came to this realization right now
Oh,
when you're describing, somebody battling addiction and alcoholism and how they feel on the inside because of all the chaos they're causing their family. But again, the same analogy can be used with somebody that's got some type of chronic illness and they see the toll it's taking on their family because their family has to take care of them.
right. Well, and I think you're spot on where it's like, hey, you look at addiction as a chronic medical illness. And what do chronic medical illnesses have? Right? They have symptoms. There may be flare ups. And there are lifestyle choices, changes that people can put into place that helps kind of keep their disease in check.
Absolutely.
And so that's the part when you kind of look at like, what does recovery from this look like, right? It's that sense of community. It's the behavioral changes that get put into place, spiritual practices,
Mm-hmm.
and not engaging in the behavior that escalates this or feeds this or triggers it. Which again, it's not just a matter of willpower, not just saying, I'm just going to kind of grin and bear it, take and just kind of get through it. No, it's like complete and total lifestyle changes have to be put into place to put one in a position to move forward while also carrying their disease with them and not letting it be the thing that's kind of driving their interactions and their choices. It's kind of keeping it in check.
Yeah. I mean, again, the same comparison can be made with other diseases as well. I mean, the gentleman that spoke to me in psychiatric care when he shared his story, he compared it to diabetes, as we talked about before. What you just described and changes to your daily activities or daily rituals or daily diet or what have you. What the hell does a diabetic have to do to keep their check? It's the same thing. I think like where we have to get better at as a society, as support of family members and so forth, is the educational component.
Mm.
I mean, I know we've come a long way as a society. I do, but we got a long way we have to go because one time I was actually having this conversation. I was having this debate with an individual, and this was not that long ago. This was this year. And somebody actually called me a narcissist for comparing this against other diseases.
Mm.
And that I was trying to justify my actions and the path I went down. And I'm pulling up the information off the internet showing them, no, I'm giving you facts, man.
Yeah. Right, because it's a different approach. It's a different angle. It's like, hey, this is how it is versus like maybe our mind might say it is.
Yeah.
Very different. And so that's the part, right? We're kind of looking at this. What initially may have started as a choice doesn't continue and doesn't continue to be a choice the further we kind of go down this road here. And so that's the part. What we know is that people and individuals caught up in this, they don't deserve punishment. They don't deserve, shaming, criticism, or condemnation, right? Like what they need is compassion. And what we know is that recovery is possible. I mean, hell, like your book you put out, man, kind of like highlights that. And so I think you really kind of hit on a key point there, Mark, too, where you kind of highlighted and spoke on the fact that how we understand addiction, both socially, personally, and scientifically, can open the door for us to really take that more compassionate, understanding approach instead of that, viewing it through a personal failure type lens or choice lens that, people are just bad at making decisions. And that's not the case when we're talking about this. And so, as always, appreciate everybody taking the time to be here. I know this is a topic that we could spend, countless hours just kind of going over and talking about the intricacies of, and really kind of looking at how this view has kind of shaped society's approach, shaped our healthcare systems, and the treatment that those impacted by, substance use disorders and mental illness has been historically. And I think we're doing a better job, like Marc said earlier, about really starting to understand this and treating people with compassion and really understanding that, hey, this is, the pain that's underneath it, right? Really treating that and helping people not have to carry this boulder of shame with them as they kind of try to move forward and live their life and find meaning, purpose, and a sense of self and direction in that process. And so thank you, everybody, for always joining. Our episodes air on the 1st and the 15th. And so we will be back next, in our next episode here. We're going to dive in and talk about how do you manage the holidays? Dealing the holidays. I think this is an annual topic that Marc and I kind of dive into here because it just needs that kind of attention. And as always, we're going to talk about the importance of being proactive versus reactive during this time of year and prioritizing one's own self-care and recovery and make sure they're setting themselves up for success here. And so, Marc, as always, appreciate your insights, especially kind of in this topic, as always. And we will look forward to catching everybody on the next episode. And until then, thank you, everybody.
Thanks for joining us today on Healing Minds, Stories of Resiliency and Recovery. If you're on the journey to find guidance and insights, subscribe now wherever you find your podcasts. Healing Minds, Stories of Resiliency and Recovery is an educational resource, not a substitute for medical or therapeutic advice. The opinions expressed by the hosts and their guests are not necessarily those of NAMI DuPage. Go to namidupage.org/podcast for links to past episodes, show notes, and to submit a question or topic ideas for a future episode. Until next time, be well.